The early years of childhood are a crucial developmental period. Evidence shows that ensuring children have a good start in these first years can make a lasting difference. Tackling inequalities in children's early experiences is therefore crucial if all children are to have the chance to fulfil their potential. This is widely accepted in theory, but in practice, our current policies don't live up to the challenge. From 2017, disparities in children's outcomes at school starting age started to increase after a number of years in which the gap had narrowed. In our recent research, we've examined policy since 2015 to try to understand why. Let's look at two key areas: early education and childcare, and family poverty. First, childcare. This is an area that has seen investment. Government spending on childcare has increased since 2015, driven by one big item in particular. Working families of 3 and 4-year-olds gained access to 30 hours of free childcare, up from the 15 hours available universally to all children. Around a third of 3 and 4-year-olds benefited from this rise. It's a popular policy, and it helped improve childcare affordability for parents with children this age. But there's some less good news. For one thing, the funding for the policy has been found to be insufficient, and this seems to have pushed up prices for childcare for younger children as settings try to cross-subsidise the places. Second, there hasn't been much attention to the quality of provision, and in fact there's evidence that quality has got worse. If childcare is to have a positive impact on children's development, not just be somewhere they're parked while their parents are working, quality really matters. Yet the number of children who have a teacher or other qualified graduate working with them, a key marker of quality, has fallen. This is partly because pressure to deliver the free hours led to funding changes which squeezed some of the better providers. State and voluntary sector provision has fallen, while private sector nurseries, many of them profit-making, are becoming increasingly the norm. Let's look at children from households on the lowest incomes, those who'll go on to be eligible for free school meals in school. Almost all these children access some early education when they turn 3. But back in 2010, 70% went to a school nursery class, which meant they had a qualified teacher leading their class. By the end of the decade, this had dropped to only 56% of children. A growing share were attending a private sector nursery, likely to be much lower quality. A third problem is that while the government focused on childcare, it allowed other aspects of early years provision to continue to decline. Sure Start Children's Centres play a crucial role in supporting families before their child is ready for childcare or preschool. They've been found to have positive effects on parenting and on children's health outcomes. But spending on Sure Start Children's Centres had fallen by 47% between 2010-11 and 2014-15. In the subsequent 4 years, it fell another 43%. Let's turn now to look at another issue which we know is key to ensuring children's early development: household income. Research tells us that living in poverty has a lasting effect on children. We also know that social security benefits are vital in combating poverty, especially during a child's early years, when families face greater barriers to employment. But this was a period of real terms cuts in support for families. Family benefits were frozen in cash terms between 2015 and 2020, meaning the money received was worth less each year. Further cuts particularly affected larger families. Notably, the 2-child limit means families who find they need financial support, perhaps due to job loss, family breakdown, disability, can only receive help for 2 of their children. The result of these cuts is rising poverty, especially in households with a child under 5. This is an unwelcome change in direction after more than a decade in which support for families increased and child poverty fell. Our research focused on the period up to early 2020. Since then, the global pandemic and the cost of living crisis have posed further challenges to early years services and to family income. Looking ahead, public money is certain to be tight. We hear a lot about difficult choices to be made. But finding a way to reduce poverty and invest in services for our youngest children is vital to ensuring a positive future for them and for us all.